Mabuhay future nurses! Welcome to Maternal Nursing 101 with me, your student nurse, Edmond. In this video, I will be administering an enema. So let us first define what an enema is. So an enema is a solution that is introduced into the anus and into the large intestine with the primary purpose of distending the intestine or irritating the internal mucosa, thereby producing or increasing peristaltic movement and facilitates the excretion of feces or flatus. So before we begin any procedure, when we administer enema, we have first to assess the client. What are we going to assess? We have first to assess the last time the client had a bowel movement, the type, the consistency, as well as the color of the bowel, and we have also to identify if there is a presence of abdominal distension. So, abdominal distension may indicate that the client is having flatus or gas into the large intestine, accumulation of gas in the large intestine causing a distended or bloated abdomen. Now, if we also need to assess if the client has a sphincter muscle control. This is very important in order for us to know if the client is able to control the feces, if he or she can go to the toilet after the administration, or if she needs assistance. So this is very important to consider if the client is having an internal sphincter control. Next is we also need to assess whether the client can use a toilet. Because if the client cannot use a toilet, we can prepare a bedpan or a commode where that will serve, or that will be the one that you will be using to defecate. So what are the equipments usually used in this procedure? First is we have the disposable linen saver pad. It is usually put under the hips of the patient to prevent the bed from being soiled from the solution if ever. Next is a bath blanket. This is used to cover the patient or to drape the patient. Doing this will also lessen the embarrassment felt by the patient during the procedure. Next is of course the clean gloves. We will be using clean gloves in order to prevent the transmission of infection because we are dealing with secretions. It has a possibility that the bacteria will be transferred to us. So in order to decrease it, we have to use clean gloves. And we have to use water-soluble lubricant, which facilitates the easy lubrication of the tip, the tube of the drainage tube. And since that we are using a large volume enema in this video, we will be using a solution container with tubing, appropriate tubing, and also with appropriate tubing and clamp, and with also a solution, 500 to 1,000 milliliters of normal saline. Our client complained that she is having a hard time defecating. That is why the doctor ordered to administer a cleansing enema to the client specifically using an hypotonic solution. So when we speak of hypotonic solution, we are administering an enema at a usual dose of 500 to 1,000 milliliters using normal saline. So hypotonic solution distends the colon, it stimulates peristalsis, and softens the feces. Now, what we are going to do is we will be administering a large volume cleansing enema to our patient. So let us suppose that the bag is already filled with 500 to 1,000 milliliters of water. Now what are we going to do is to remove and expel the air from the tubing. The air, although not harmful, it may cause unnecessary distension, abdominal distension to the patient. So what are we going to do now is that we will be opening the clamp and let the solution run into the tube. Okay. Now we will be going to close it if we are sure that there is no air left in before we begin the procedure, of course, we have to introduce ourselves to the client, clarify the client's identity, explain the procedure, and tell the client how she will going to participate in this procedure. So, magandang umaga po, ma'am. Ako po si Edmond M. Bigata, student nurse po ako from Camarines Sur Polytechnic Colleges. Ma'am, can I ask your name po? Tingnan ko din po, ma'am, yung service badge ninyo. Okay po. So, ngayon po, ma'am, dahil nga po hirap po kayong kumain, na-order po sa inyo si Doc ng Enema. So, ang Enema po ay ang solution ay nilalagay po natin sa ating sa puwet po ninyo para po lumambot yung tae at mailabas po ninyo. So, ang mangyayari po ngayon, mag-insert po ako ng isang tube dito po sa puwet po ninyo, Mag-insert po ako at makakaranas po kayo ng fullness o kaya ng bloating po, which is normal lang naman po ito tuwing nag-administer po ng Enema. Ngayon po, ma'am, ang mangyayari po ay ipoposisyon po kayo in a left lateral position. Okay lang po ba ito sa inyo, ma'am? Sige, okay po, ma'am. Sige po. Babalik po ako, ma'am, after po mag-practice ng induction control procedure. Sige po. So, after we verify and introduce ourselves to the client, we will now be practicing proper hand hygiene and other infection control procedures. Now we will be applying clean gloves. We will now be applying clean gloves. And then after we apply clean gloves, we will now be providing client privacy by closing curtains and by closing the curtains. So now, what are we going to do is we will now be assisting the client in a left lateral position or Sims position with her knees actively flexed. Now we are doing this position because it will allow the flow of the solution by gravity into the descending column and to the sigmoid column. Now, the reason why we are going to flex the knees of the client because it will allow us, the nurses, to visualize the anus, to visualize the rectum, to visualize the anus. Now, but first we will be putting a linen under the client, an absorbing linen under the client. And then now we will now be assisting the client in a left lateral position with her knees actively flexed. Now using a bath towel, we will be covering the areas of the client that are not needed. So we will now be exposing the anal area. Doing this will, of course, lessen the embarrassment felt by the client when doing the procedure. Now we will be using what we will not be lubricating it. To facilitate further good visualization, we will be lifting the upper bottom. And then we will be inserting the enema slowly and smoothly towards the direction of the umbilicus. Okay? So we have to remember that the anal canal is approximately 2.5 to 5 centimeters. That is why we have to insert the tube at approximately 7 to 10 centimeters also. Now, if we felt resistance, the internal anal sphincter is resisting. Once we've inserted the tube, we have to ask the client to do breathing exercises, deep breathing exercises. Ma'am, can you inhale po? Exhale po, ma'am. Isa pa po. Okay, now, if you've already done deep breathing exercises and there is still a resistance when we insert the tube, we have to check if there is a stool present that might be blocking the insertion of the tube. Now, if still we already checked and removed the stool that might be blocking the tube, and we have asked the client to do breathing exercises, but the resistance continue to persist, we have to end the procedure. We have to stop the procedure and we have to report it to the primary healthcare provider and the nurse in charge. Now, we have to remember that we should never force the tube or the solution to enter the anus because it might cause trauma or injury to the patient. Now, let us assume that there is no resistance with the patient. We will now be inserting it at 7 to 10 centimeters. We will be opening the clamp and raising the solution container. For a low solution enema, we have to remember to raise it at 30 centimeters, while for high enema, we have to position the solution bag 30 to 49 centimeters above the rectum. So since this is a low enema, we will be positioning it at 30 centimeters above the rectum. We have to remember that the higher the solution is held above the rectum, the faster the flow, and the greater the force or the pressure is inserted into the colon. Now, we have to administer the enema slowly and gently. If the patient complains that it is painful or she is experiencing fullness, we will be closing the clamp, or we will be closing the clamp and stop the flowing of the enema, or we will be lowering the solution back. So why do we clamp and close the drainage tube if the client complains pain or fullness? So doing the clamping of the drainage tube will decrease the likelihood of the client to have intestinal spasms, and also it will reduce the likelihood of the overflowing or the premature ejection of the fluid of the solution into the rectum, into the anus. Okay. Now let us say for an instance that we are already done administering the enema. We will be getting some tissue tube and wipe the anus of the client, and then discard the solution and discard the drainage bag. So the primary indication that we've already administered enough enema to the client, already administered enough solution to the client, its primary indication is that the client already have this urge to defecate, or we've already administered all of the solution. Now, once we have administered all the solution, we will be asking the client to remain lying down. We will encourage the client to remain lying down because lying down facilitates the retention of the enema into the colon. So, we have to ask the client to retain the solution at an appropriate amount of time it needs to effect. So, since we've used an hypotonic solution, we have to request the client to retain the solution for 15 to 20 minutes. Now, after the 15 to 20 minute time is over, we will now be assisting the client to defecate. So what are you going to do is to assist the client in a sitting position and allow the client to defecate either in the bedpan, in the commode, or if the client is still able, she can defecate in the toilet. But if there is certain fecal test necessary or ordered by the physician, it is appropriate that the client will defecate in a bedpan or in a commode. Now, if the client use toilet, we will be asking the client not to flush it right away because we still need to check or observe for the feces. We have to observe its consistency, the type, the color, and any other parameters needed in order for us to determine if there is still problem with the patient. Now, since we've already done with the procedure, we will now be removing any other equipments, discarding. We will be removing our gloves. Perform proper hand hygiene. And we will now be documenting all the findings. We will be documenting the type and the volume of enema used, and of course the characteristics of the feces that was excreted by the client. So that's how we administer an enema. Once again, this is Edmond Ambigata, wishing you to have a good day ahead. Thank you.